Good afternoon, everyone, and welcome to Karma Summit India. My name is Tejashree, and I am a manager in the business consulting team at Goodera. I really want to thank you all for joining us today for the discussion on strategy for CSR continuity. This is really a great opportunity for everyone in the CSR ecosystem to understand ways of building strength and resilience in the CSR programs to ensure their continued impact. This is important, especially in today's pandemic hit world where there are numerous challenges, the challenges ranging from those for human interactions, business operations, social development projects, their planning and execution as well. Today, we are extremely lucky to have a diverse panel of experts to address such an opportune and vast topic. We have these experts coming from corporate, NGO, and academic backgrounds with decades of experience in the social sector. Before we begin the actual discussion, I want to introduce all the panelists to the audience today. We have Mr. Pankaj Ballabh. He is the Vice President CSR at Bajaj Auto and comes with 25 years of experience of working with grassroots development organizations and large MNCs, dealing with issues of development, sustainability, and corporate responsibility. Welcome, Pankaj. We also have Ms. Supriya Singh. She heads the CSR vertical at Tata Communications. She comes with over 16 years of experience in this space. Her work primarily focuses on creating large-scale sustainability programs through multi-stakeholder partnerships for societal transformation. She is the national coordinator and member of ESD Expert Net, a four-country network supported by the German government. We are delighted to have you join us, Supriya.
Thanks, Tejashree.
We also have Shripad Desai. He is the MD and country director of Americares India. He brings in 30 years of experience in India's healthcare and development sector. He oversees all the aspects of the organization's work in the country, including emergency response activities, access to medicine, and highly successful clinic to community programs for the urban poor in India. Very, very glad to have you with us, Shripad. Welcome.
Thank you, Tejashree.
We have Professor Vasanthi Srinivasan joining us today, and she is the Organizational Behavior and HRM professor at the Indian Institute of Management, Bangalore. She is published researcher with her research interests being women on boards, business and human rights, and HRM in the rapid growth context. She runs a website as well called www.teachcsr.com, which is intended to enable faculty in business schools to mainstream teaching corporate responsibility. Vasanthi is currently on the board of directors of Enable India and Fourth Wave Foundation. Thank you for joining us, Vasanthi. Thank you.
Thank you, Tejashree. Thanks.
Okay, so coming to the session now. So COVID-19 shook the world in an unforeseen manner, and its impact was unprecedented since 1930s Great Depression. No one ever imagined the destruction of economies of more than 100 countries across the world that was caused by the pandemic. Every country tried to grapple with the pandemic by diverting funds, resources towards relief and rehabilitation activities. The corporate sector and the NGOs were some of the key contributors of these activities. This resulted in the CSR priorities being shuffled. Plans and strategies needed to be reconsidered. And if we have to do so effectively, establishing strong partnerships between the corporates and the NGOs is extremely crucial. In this session with the distinguished panelists today, we will discuss strategies based on their experience to reprioritize CSR goals, funds, and programs for continued impact despite the constraints imposed by such a pandemic. They will also ideate together on ways to build sustainable and impactful partnerships while effectively mitigating such risks. Let's start off this conversation by first understanding the magnitude of damage caused by COVID-19 to the CSR programs and initial response to that by the stakeholders. First question to you, Supriya. What kind of projects do you think were impacted the least and the most because of the pandemic?
So I'll start off by talking or giving a sense of, the CSR universe that Tata Communications has. So we work with about 16 partners and across 9 states in the country. And we primarily work in healthcare, education, and sustainable livelihoods. Now, if I have to answer this question, the easy answer would be that the projects that had a higher level of digitalization were the ones that were least impacted because they could still continue in the digital format and digital mode. But I think this is a much deeper question because of course, all projects were impacted. We were under a lockdown for about 3 to 4 months, and that was a strict lockdown. So any program that that was at the grassroots, that required people to people connect, and I'll be surprised if there's any CSR project that doesn't have that element. I think everything was impacted. But what we also need to reflect on is that more than the project at the grassroots, the working of the organization itself was impacted. The field staff that are not often spoken about, who actually implement these programs, could not travel. There was constraint on mobility. Not many organizations were prepared for a work for home situation. So while when we talk about work for home for the corporate sector, it's essentially understood and it's widely practiced. But in my experience, I realized that some of our partners struggled a lot with this situation of having their staff overnight transform to us or adapt to a work from home situation. So I think there are two parts to it: how organizations themselves were impacted, and then of course project on ground. But in terms of types, I would say I think most programs were severely impacted, especially school programs, I would say, because learning in a lot of ways has come to a standstill in the country. And for us, we saw it was slightly more easier to work in the rural areas, our programs that were there in the rural areas rather than the urban centers, because they were really the hotspots of the pandemic.
Right. I think I want to draw from that idea which Supriya mentioned, that the organizations on the ground got impacted severely. So Shripad, next question to you, since you're representing the NGO universe today for us. What are the top 3 areas of NGO operations you think got severely impacted because of COVID? And in which ways NGOs are responding to that situation?
Sure. That's a great question because, like the entire world, of course, the world of NGOs also is impacted by COVID-19 situation. And I would say I would divide that impact one in immediate term, which is typically the 0 to 3 months, and then medium term, which typically goes up to, let's say, next 2 years. I'm not really talking of what happens after 5 years, but for the discussion's sake, if you look at these two aspects, I would say the NGOs were both impacted negatively as well as positively. And I would also spend some time talking about how the NGOs have taken positive out of it, because there's a lot that has been talked about the negative impact of the COVID. So when we look at the the immediate impact, I would say, if in one line, the immediate impact, like Supriya mentioned, I think work came to standstill. In the first 0 to 3 months, there was no access to the beneficiaries for 2 reasons. One, lockdown, and for many organizations like us who work predominantly for urban poor, migration was one of the major challenge that came across, because we were not able to, and because of which we were not able to reach the beneficiaries. That had a direct impact, obviously, on our program delivery. And for a healthcare organization like Americares, continuity of care became one of the bigger challenge in the immediate term. Not that we didn't address it, I'll come to how we address it, but that I think most of the organizations face that. Third most important aspect that I want to highlight is the human resource constraint for a NGO staff itself. So we have to appreciate that most of the NGO staff, particularly grassroots level NGO, comes from the communities that they operate in. And they are, like, for example, in my case, we had three healthcare workers who live in Dharavi, and we know the situation in Dharavi. So we had a situation wherein our own staff were at risk, as mental stress, mental well-being issues, and even burnout. And I don't think many NGOs were prepared, equipped to address the staff health issues per se. So I would say in immediate term, that were the issues. As we move further now, when we look at 6 months to 24 months period, I feel one line impact of that is going to be that NGOs will no more be able to do everything they wish to do or they are good at. Why? Obviously, we know that there is budget optimization that's happening. In my own organization, I would say we have three major programs wherein we have sat across with the donors and we have renegotiated the budget, so to say, in terms of our program delivery as well as obviously budget impact to the tune of 25 to 40%. So that I think is a one sizable impact. That would also have a direct impact on reduced wages in terms of putting staff under pressure, because the moment you have budget reduction, there are pay cuts that are happening, and we know the situation right now that onions are available at 100 kgs, and we are forced to reduce the salaries of our staff who are, like I said, coming from the same community. Third most impact what we have realized is that FY21 projects, so many projects were starting in April, and COVID hit in somewhere in that period. So many organizations, NGOs that I know, wherein projects were stopped, and the money funds were diverted to COVID. So that's really another long-term impact. Having said that, what is the positive? How did we as an NGO fraternity turn around the situation? I would say yes. One, we were forced to think alternative ways. I think one of the biggest positive of COVID is that NGOs have been forced to think alternative ways.
Yes.
I have a mobile health center program which reaches out to about 800 people every day, and we had a situation in March wherein we were no more able to deliver it. But we were quick enough to come back with a telehealth program thanks to the electronic medical records that we use, and we were able to quickly turn around and reach to our beneficiaries and be back on the road, as they say.
Sure.
Second aspect
I think,
that I would like to
Shripad,
talk about is
sorry,
yes.
we'll talk about the future-proof, making the projects future-proof in our last section. So please save your comment for that section if you don't mind.
Sure. So okay, so you don't want me to talk about the positive impact right now. Okay, sure.
Yes, so we'll look at it as an opportunity in the last section. So
sure.
So coming to Pankaj, so Supriya and Shripad articulated very well for us what was the impact the entire ecosystem felt. So Pankaj, can you elaborate for us your approach to reconsidering, reprioritizing, and restructuring your CSR investments, partners, and cause areas that you work in, so that you could actually invest in COVID-19 relief and rehabilitation?
So what I was saying was that Shripad, I think, paused at a very relevant point that I need to talk about the positives, and that's where I want to start. So we work with close to 250 partners directly, and I think the remarkable feat was that the lockdown was declared on 25th. On 27th, we were able to start supplying cooked meals to around 40,000 people. I think 2 weeks into the lockdown, one of our first NGOs restarted their mobile healthcare program in Uttarakhand. So I think before many of us were kind of able to react, we started getting inputs from partners who were in some state of readiness to respond. So, and like the midday meal program repurposed this kitchen and the food stock they already had to start providing meals for the migrants. The other good thing was that even though it was a lockdown, some of the civil society organizations were able to get permissions, because food distribution is a huge logistical challenge. 40,000 migrants are not at one place. They were dispersed in 550 locations in Pune. We were able to supply them, and within a very narrow time window, because the cooked food goes bad very, very quickly. So the food was able to be delivered to them respectfully and while it was still edible. I think, so we found many such examples where people and many organizations that are working in rural areas where the lockdowns were not so strict were also able to create collective kind of reactions where food was supplied to each other. So many interesting things happened. And I think whether they were donor-led, I would say not. Whether they were triggered by the community, not by the organization. I would say I don't have evidence either way, but many interesting things happened that we still need to kind of get together and collate. I think digital, as Supriya mentioned, was a very easy, low-hanging fruit for many organizations to start reaching a part of the community. And the minute they started, we realized that digital access is a myth. It doesn't exist in the real world. 10%, 15% have it. And then you introduce elements like the earning member needs to carry a phone with a particular app on it in order to access their work site. The phone goes out of the house. It is not there inside the house. Zoom, which we are using so happily right now, is a network hogger. So 2 hours of Zoom and you are through with the 1.5 GB for the day. So I think there are a lot of interesting challenges and we are still learning in how to kind of take it forward. But I think
Okay, I think we'll move on. So Vasanthi, I want to now ask you. You are a researcher, right? You are an academician. So what is your perspective on the approach which was taken by corporates and say the entire CSR ecosystem towards addressing COVID-19 challenges? How would you look at that from a researcher or academician's perspective?
So I think I would look at it in terms of 3 perspectives. Okay, so broadly, the first one that I want to talk about is what Pankaj mentioned, which is about what we saw happening was organizing, not organization. Often we confuse these two as, we think we need organizations to do organizing. Actually, what we saw was organizing was happening by different actors, and several of them would not traditionally fit into a CSR, a corporate, an NGO, none of those labels. There were bureaucrats out there organizing just as much there were common citizens who were doing it. Okay, so in some way, I think for the first time, India recognized the power of organizing, and probably the closest we may have come to this was during independence, because that's what history tells us, right? We have not seen it, and I think we have taken it for granted that organizations are the only way to organize, okay? And that's a myth that I think has been challenged. What are the implications for this? We will have to look at as it unfolds. The second piece that I want to reflect on is to build on what Shripad said, which is that there is a power, a native intelligence of innovation. I think under all these systems, procedures, frameworks, and everything, we have lost the native intelligence and innovation that anybody can bring to the table. And I think COVID has been able to help us to discover that we are natively intelligent people and that we are capable of solving our own problems with a little bit of facilitation. And the last one that I think for me, the biggest takeaway is that we have not yet even now recognized that COVID is a complex problem. So far, we have seen simple problems. How do I make sure that communities get delivered the benefits that we are providing? That's a simple problem. A complicated problem is making sure that every member in the community has access to a medical checkup, or you have the entire education system set up in a way that children can actually acquire life skills. Those are complicated problems. We will have to try them once, try them twice, and you'll get it right after 5 times. And I think CSR was headed in that direction of getting it right in the last few years, which the NGOs have done for several years. Okay. But a complex problem is one where there are very high interdependencies. And anything that happens in one part of the system has implications for all actors, intended or unintended. Okay? It's that complex system that COVID is. It's uncertain, it's unpredictable. We don't know whether it's a first wave, second wave, third wave. So in some ways, a complex problem requires systemic, interconnected thinking. And at this point in time, I want to just leave saying that I am not able to still see that systemic, interrelated thinking to handle complexity. And which is why the point that Shripad said of 24 months or 36 months, I'm also able to see 5 to 10 years from hence, because I looked at the Spanish flu and the plague. The consequences are only 5 years later. What happens when children, like Supriya said, have dropped out of school for 1 year? How do you actually bring them back? What happens to the TB patients and HIV/AIDS patients who've dropped their treatment? Those are not fixed in a day or a year. Okay, so complex problems have consequences, unintended and intended, and I think we are still figuring that out.
Right, right. I think the biggest takeaway from what Vasanthi mentioned right now is the inclusive development and how we need to come over the frameworks and the modules and all of that and really look at the native intelligence and the ability of all the stakeholders in the CSR ecosystem to give and take. It's not like one stakeholder is capable of giving and the other one has to receive. So really, thank you everyone for your inputs. And from these conversations, we have realized that the challenges faced by the entire ecosystem required combined efforts. And the projects that stayed on and continued had strong partnerships as the foundation. If we have to make the ecosystem work in a more inclusive manner, I think what we need is, as I said, the give and take between all the stakeholders so that we have impactful partnerships and the impact of them lasts really long. The next section, we are going to discuss the real on-ground experiences of you all. So Shripad, what inputs you think an NGO would require, say from a corporate partner, to future-proof their projects before, during, and after such a pandemic? The inputs I'm suggesting are along the entire program life cycle, be it in the planning or designing stage or at the planning and execution stage. So which inputs are required by an NGO from a corporate?
So when we talk of post-pandemic scenario, I think I think all stakeholders, be it donors, NGOs, government, and even beneficiaries themselves, I would say, are still learning from this pandemic. Every day, I think we know that new data is coming and it's offering new information, and therefore a lot of fluidity currently in the system. But if one thing that we have learned as a development sector, I would say, is that what brought us here won't take us there. I think that's something that has clearly come out of this, particularly when I represent the NGOs, when I look at our partner NGOs and even fellow NGOs. So one thing that will help us survive is, I would say, redesign and realignment. And I think that's where I would say corporates would play a very, very big role. If you ask me, three things that each NGO is, just like every country, every corporate CSR or corporate strategy per se is undergoing a change, I believe every NGO, and I'm talking of say sub 10 CR NGOs, we'll have to look at our so to say business model, so to say our purpose model, and so on. I think three areas that I would request, I would see corporates playing a bigger role is one in helping the NGO partners to redesign, rethink their strategy. So one is strategy development, I would say. Second could be technology and innovation. We are hearing technology and innovation are the buzzwords, but I don't think the grassroots NGOs are yet ready for it. So that would be the second piece. And third most important thing, which is going to be important, because from QI and QA perspective, when as a non-profit, my purpose remaining same, when my resources are limited, I have to make sure that I am able to deliver in place of 12 visits. If my health worker can do only 6 visits, and if I have to achieve the same result in 6 visits, obviously there has to be a appropriate QI and QA going in. So I would say, to summarize, maybe hand-holding in terms of helping the NGO to identify what is their core mission versus say complementary initiative versus peripheral activities, and helping the NGO to bring their all resources first to deepen their core mission. That's something that would be really helpful. Second, digital adoption. And I want to take clue from where Pankaj mentioned, everybody is talking of digital, but you can imagine a banking CSR initiative wants the beneficiary to have a finance literacy model. A school is wanting them to have a school e-program. I am like a healthcare organization wanting to have a health app, and nobody is thinking about the beneficiaries. So how do NGO think about integrating their digital model? We can't have 20,000 NGOs designing 20,000 apps, obviously. So there is a lot of learning, and as NGOs, we don't know how to address it. So I think that's another area that where corporates could play us. Innovation, again, corporates are so used to innovation labs and brainstorming sessions. I think that would be really helpful. And third most important thing in terms of process optimization tools, the discussions that we are having here, I think that is the third most important help that corporates could do to NGOs so that we are ready for the future post-COVID.
Really nice. Thank you. I think that was quite insightful answer. I think I want to go to Pankaj to talk about the flip side of this, to understand how and what learnings that corporate can get from the NGO counterparts. What kind of tools and processes you think can be shared between the corporates and their NGO partners so that they can learn and adapt from each other?
I think there are many. I mean, and when I'm saying NGOs, I think, and Shripad, I think, would agree that there are NGOs and there are NGOs. I think participatory tools is something that the NGO sector has worked with. I mean, since I started in 90, I think that was our bread and butter kind of way of doing things. So actually, none of I mean, if you look at CSR rules and regulations, the beneficiaries don't have a voice in it. They are passive recipients of largesse given to them by the corporates. I mean, it's a terrible structure for doing development. I mean, it's a horrifying structure. So then it is up to us, the people who are involved with execution of CSR, to build into our systems, our processes, those participatory models that the NGOs know and work with. The other, I think, is, see, outcome, and this is one of my favorite bad jokes, that when you talk about low-hanging fruit, somebody else had planted the tree. Otherwise, 6 mahine mein no tree gives you fruits. So, I mean, if you want instant results, do agriculture, don't talk about horticulture. So that patience that the development sector requires is not there in CSR. That you need to invest in communities. You need to not invest in impacts and end of 6 months. What is the transition in the baseline? We need to forget all of that. So I think there are very many elements of the way NGOs have understood how development happens on the ground. And I think one of the big problem areas, and I think Shripad and others will have to really work on it, the wrong messaging is also largely being done by a certain set of NGOs. There is a reason why all of CSR is comfortable with impact models, is that nobody is telling them that, hey, listen, impact doesn't happen in isolation or doesn't happen in 6 months. So why is a certain set of NGO community hiding the background work that has been done over 5 years, 6 years, 1 decade? So I think there are many things we need to learn and many things we need to be taught. Learning doesn't happen without a teacher. I mean, Vasanthi is a professor, she would realize that. I mean, you need to be coached, and I mean, learning can be in many different ways. But I think CSR needs to learn how to learn first, and then there are certain very fundamental tools that we need to start using, certain expectations we need to moderate. I mean, there is a huge learning opportunity here, and which will also benefit us in the way we do our business. I mean, learning how communities use soap probably will benefit people who make soap. So, yeah.
I think what I would take away from Shripad and Pankaj said is, the having really the bottom-up approach rather than sitting in a room and imagining the reality, and rather
That's
doing.
Why I wanted my camera to show you the outside, not show you the room only.
Right. So Supriya, actually, next question to you. See, risk such as this pandemic, right, needs to be thought through from a future-proofing perspective. So, as a CSR leader, how do you ensure that you kind of incorporate the risk management systems and processes in your CSR budgeting, project planning, and also the kind of partnerships you pick up?
So I think the first thing I would say, and what Shripad has been saying, that we are still learning from this, Tejashree. We have not seen the end of the pandemic. And it will be a while before we, actually can very confidently say what we have learned from this. So, please humor me with what I'm going to say, because it's really some of the early, I would say at best can be called observations and reflections. I wouldn't even say these are concrete steps that everybody should take. I can talk about what we did at Tata Communications and what was some of my personal reflections. So when all this happened, I realized how uncomfortable we are with uncertainty. It's not that uncertainty never existed before the pandemic. It has always been part of our lives. But as professionals, we are so uncomfortable with uncertainty that when we make strategies, when we make these blueprints, especially in this sector, I would say that we don't do a thorough risk analysis. That's because we feel everything will fall into place. That's one part. Second is sustainable development or sustainability is complex. It's wicked. It doesn't have one way to resolve it. It needs long-term, commitment. Probably a full generation actually to solve issues. Poverty cannot be eradicated in 5 years or 10 years. So we need to ask ourselves as corporates, and this is something we are doing at Tata Communications, and we've always very actively believed and pursued long-term commitments and long-term partnerships, is that how long should we commit to a cause? Because you have COVID today, you can have something else tomorrow. And in a country like India, we are just one blink away from a disaster. It could be a flood, it could be lightning and thunderstorms, because of which every year we lose people. And because it's just 1,800 people, it doesn't make news, but we are losing people to such incidents. So long-term commitment, and then we will never get it right. I think one of the things we have to start accepting that it's not a linear process. We do 5 things and that they will result in exactly the kind of impact that we want. No, it's never going to happen. And we have to be okay with it. Everyone has to be okay with it. The corporates, the NGO partners, academia, leadership, XYZ. I think we need to be okay with things going wrong and things not happening as per plan. So what we did at Tata Communications is quickly we took a look at a strategy, and I would give you 5 steps that we followed and we are still following. The first one is we said we are going to improve our community listening, because in our effort to implement programs, I think somewhere the ability to listen carefully to the community has sort of gone out of the window. So we said we will go back to our community when the situation improves, or if we can do it howsoever, and we will improve our listening to understand what is their real need. And again, all my co-panelists are voicing it in many ways. It's not about getting, staying safe from COVID. It's a better healthcare system that we are talking about. It's not about getting your child admitted to a school. It's about getting a better future for your child. So, what is the real aspirations of our community? So that's one part. The second part is we want to, of course, work on delivery mechanism with our NGO partners, and enable them and enable ourselves to look at alternative, blended, modes of delivery. I think this is important, and again, it's not going to be resolved in 1 year or so. The third part is we are looking at, sort of working with our NGO partners to look at their HR policies, not in terms of, having some kind of an oversight, but, exchanging our learnings in human resource practices. Can some of our practices be translated to the social sector? in terms of, can there be a better mobility policy, for instance? We are trying to look at that. So we are really trying to look at the details, and we are not just trying to scratch the surface now. So we want to ensure that our partners do have these robust policies, so that they can sort of withstand the sort of shock. The fourth one is repurposing partnership. What are we partners for? What is it that we are trying to gain through this partnership? How are we establishing relationship in a partnership? Is it transactional, or are we aligning at the level of some aspirational goals which inspires action over a long period of time? So repurposing partnership would not mean doing just meetings over Zoom, but it would be really taking a step back and saying, all right, what can we do better? How can we make our relationship an opportunity for mutual learning, individual learning, societal learning, so on and so forth. And the last one is, we've got into risk analysis of each of our project and trying to look at, in different geographies, the risks are different. In different communities, the risks are different. So I don't want to use that phrase, but we have to adapt, and we have to see that these differences are integrated at every level of planning. So we are very fond of saying in this sector, one size does not fit all. But what does it really mean? Have we gotten our hands dirty and gone down to the level of, okay, what community, how many men, women, are there young people, are there teenagers, adolescents, what are their needs? It requires a lot of work. So I would just stop here, and these are some of the things we are doing, but we are not yet there. And I can assure you, it will take us at least a year for us to actually say something conclusively on how far or how much we have progressed on these 5 years.
Definitely. I mean, I agree completely. We are still on the way of learning, but the 5 steps that you mentioned would really be helpful for, the organizations who are thinking of instilling the risk management plans into their projects. I think I want now turn to Vasanthi to understand what is the role of the government. So I'll explain what I mean. So, when the CSR became mandatory, it also implies obviously that the government has to make a conducive environment for various partnerships to bloom and to function efficiently. So do you think government policies have any role or a significant role to play to help these stakeholders, be it corporates, NGOs, community-based organizations, whosoever they are, to build stronger partnerships and work for sustainable impact? What is the role of the government here?
Let me start by saying that I think we are very harsh on ourselves, okay? And why am I saying this? First one is that this act was passed only in 2013. So first, its whole implementation is only 5 years in some systematic manner. This is a legislation which is new to the world, not just new to India, okay? So in all fairness, legislations have existed for 150 years and we still have not been able to crack it. So what is it that we actually want? Okay, so let me pause there for a minute. Second one is that as long as it was not legislated, I think we had a right to quibble over it. After it has been legislated, like Pankaj said, we only have a choice of figuring out how to implement. Okay. The third piece, I think there is a trust deficit in India vis-a-vis the government. The corporate sector does not trust the NGOs. The NGO sector does not trust the corporate. Neither of them trust the government. And then we all say that the government does not trust any of us. Okay. So to my mind, this trust deficit is not sustainable in the long run. Okay. So if you tell me, will the CSR work without a government support? really, what are we talking about in terms of how much all these corporations together are going to give vis-a-vis the total budget of the country? I mean, let's put it in perspective, okay? So my personal take is that the time is past to talk of, is this the way the act should have been? Should it have been? Yeah, I think the time is past. The only way we can engage with it is that government is a stakeholder, will continue to be a stakeholder, because long after corporations stop and NGOs stop, it is the duty of the state to protect its citizens. So let's not escape that reality, okay? So my own sense, as I work with all the three constituencies, especially on the drafting committees of some of the reports that have come out in the last 2 years, I have two insights, and I think I'll probably leave with that. The first one is that the way the government thinks about its implementation is largely from one of top down. CSR is bottom up. So which means in this process of top down to bottom up, it requires enormous upward pressure, which includes reports organizations should be putting up. They must be a part of the stakeholder consultations. And right now, I'm not going to make a difference between the corporates or the NGO. It really doesn't matter, because both of them have to be a part of the policy making process. Okay, there are organizations which are a part of it, but as a community of CSR professionals, have I seen some really comprehensive, insightful stakeholder feedback to influence a policy process? No way. So as far as I'm concerned, CSR departments do not today have the capability to influence the policy. NGOs, what is their role? They have been implementing agencies of the government. Now suddenly there is no funds to implement. You're looking at CSR as another option. So in that kind of a mindset, where are you actually strategic on a policy? You are strategic as far as your organization is concerned. This is not a great, conducive environment for policy transformation. Okay? So my sense is that we need as a country to build policy capability. And in that, we are still infants. We are still in our infancy. Whether it's the RTI, whether it's the RTE, all of us have to figure out how to manage the public policy process. And that is a capability that all of us need to acquire. Yeah. So is there a way to talk of the entire corporate responsibility without the role of the government? I think not at all possible. Not at all possible.
Sure, thank you.
Can I just ask a question here?
Yes.
Sorry, it's kind of breaking your flow. My own personal impression was that the problem, the fundamental problem, is the misnaming of this entire effort. The minute we say it's corporate philanthropy, it kind of is in a different space. So this is definitely not social responsibility at all. Because if you look at environmental impact legislation, EIA legislation, that had CSR element, was looking at the business impact of the corporate, of the industry.
Agreed.
There was public consultation built in. The problem is we are calling this bit CSR, where actually it is hardcore corporate philanthropy.
Completely agree with you. Completely agree with you. And I expect that in another 5 to 10 years, it will be called that way.
It will be renamed.
It will be called that way.
And then a lot of processes will start making sense. I mean,
exactly. So as far as we are concerned, we should treat it as corporate philanthropy. And then begin to examine, even corporate philanthropy has to be strategic. That's it. And then everything else falls in terms, and that's why I like the point you said, without a participatory appraisal, what are we talking about? A planning process. And participatory appraisals, I have not seen a single project which does not have a 10-year or a 15-year lifespan on social change. So your entire CSR plan, as at the vocabulary of today, is really a 15-year plan or a 20-year plan. It's not a 1-year rolling plan like what you do for profitability.
So I think that's where the challenge is happening, Vasanthi, that we are actually having these reporting templates which say project at the end of 1 year,
Exactly.
Whereas anybody who is a practitioner has spent even a day on the ground knows that you're talking about decades, not about years.
I agree with you. But you'll also see something, Pallab, if you look at
Sorry.
Pankaj. Sorry.
But
I forgot to recording.
Couple of points, I think, whether we call it philanthropy or CSR, I mean, without going into theory here, of course, the idea we are exploring here is the business society relationship and how can business positively impact society and can lead or can contribute to societal transformation in one way or the other. So we may call it something. In Europe, it would be business responsibility or sustainability, XYZ. So regional differences would definitely be there. That's one. Second, I feel is that, nothing stops a corporate from making a commitment that is long-term. I think, we can't leave it all to the law. The law it doesn't say, in fact, the law is very clear that, you should be there, you should try and make a long-term commitment. So that's the second thing. And as CSR professionals, I think we have a lot of internal stakeholder alignment work on that aspect to do. And I think once your leadership is aligned, and I can say that, I'm sure Pankaj would also agree. Once your leadership is behind you, I think long-term commitment becomes very easy. For one Tata Group, we have minimum, our partners have been with us for about 3 years, and these are new partners. And then we have 5 years and above, and we are not our CSR journey is all of 6 years. So we really believe in long-term commitment, and I think we need to do that. We need to sensitize our internal stakeholders why a long-term commitment is required.
So drawing from that point of, long-term commitment and actually looking into the future and not planning for short term, I want to actually go to the next section, where we are exactly discussing this. How do we plan for the long term? How do we, how do we opine on the preparedness, various coping mechanisms, that we have or we can think of? We'll also in this coming section are going to discuss some non-negotiable themes, right? Like gender or technology that we must now onwards instill in our programs. And also we'll think how social development is going to look like in the post-pandemic world. So first question to Shripad. In the near future, from the NGO perspective, what do you think will be the biggest challenges? And we want to hear your recommendations also for that.
Sure. So for many grassroots organizations, I think survival itself is going to be one of the biggest challenge, given the situation that they are in, that we are foreseeing. Having said that, for those who survive, I think I would like to talk about 2 aspects of impact or challenge. One, maintaining the current level of impact with lower level of resources. I see that as the biggest challenge that all of us are facing now. And second, staying on course with the purpose or objects of the non-profit, staying on course with why you actually started what you started off. And I'll talk about it in detail. When I say maintaining the current level of impact, we all know that all the vulnerable population that we serve have become even more vulnerable now. And one of the things that has impacted is obviously loss of wages, income, etc. So what we are finding is that we are suddenly back to maybe 2 years where we were. To give you an example of a school health program that we run, where we've just had children who are now learning to, let's say, brush twice daily or eat a fruit a day, with parents, one of the parents losing the job, loss of income, etc. Suddenly now we cannot expect them to start back where they are today. So there's going to be a time lag. Particularly in terms of healthy behaviors, there is going to be an impact. So we have a situation wherein the vulnerable has gone down. At the same time, the providers, NGOs, they are also become more vulnerable, both from uncertainty perspective and funding issues that we are forcing. So I believe one of the biggest challenge each of us are facing is, how do I achieve my purpose, or how do I maintain the current level of, you can say, impact, programming, etc., with low resources. So how we are looking at it, we are looking at it from 2 perspectives. One is ensuring resilience. So which obviously is in short term, looking at your operational sustainability, talking to your donors, renegotiating your MOUs, and looking at long-term partnerships, employee safety, etc. But I think more emphasis is required on what we call as reimagining your purpose, reimagining your mission, rechannelizing your resources. Like I mentioned earlier, we are classifying our mission in three. One is core mission, second is complementary initiative, third is peripheral activities. To give you an example, as a health focused organization, our core focus, let's say when we talk about mobile health center program, is when we work in the communities, we are ensuring access to healthcare for the urban poor community. So that's really our core mission. So we want to kind of channelize all our core resources to strengthening that core mission. What is let's say complementary to it? Let's say health financing or health insurance, that's complementary. And third would be, which is periphery, would be helping the communities earn more so they can invest in their health. Now, when I have resource crunch, we are very clear that we are not going to get into peripheral activities. The resources that we have, if we have supplementary resources, we may invest in complementary initiatives, but our core funding has to go into our core purpose or core mission that we have. That's one suggestion or one thought I would like to leave the audience with. And second most important thing is about resources. And when it comes to resources, we all know that in our country, like one of the panelists mentioned, that from government funding now it's all come to corporate CSR or corporate foundations. With FCRA coming in, we have not discussed FCRA and how it's going to have impact on even the partnerships and other fundings, but that's another challenge that we are seeing. The second recommendation that I would have is expanding the resources. If we are too dependent on corporate CSR, we ourselves are looking at how do we expand our resources to other buckets, so to say, like HNIs, individuals, crowdfundings. Though they may never be able to replace what a corporate CSR foundation can bring in, but it's always important, particularly when it comes to expanding your supplementary funding for your complementary initiatives. One should look at that aspect. So that's one. Second challenge that I mentioned is about staying on course with purpose, and this is the biggest challenge I feel. With resource coming down, particularly for, let's say, sub 5 CR NGOs, there is going to be I would say, a risk of losing focus, taking small time projects just to make sure that you are able to survive. I think that's going to be the biggest challenge. So there, my thought is that one should avoid short-term gains, learn to sacrifice, I would say, and my choice would be to work on a low-budget, sustained engagement, say 3 to 5 years kind of projects, rather than taking a huge budget 1-year program. So because as an organization, as your purpose, staying on course for which you have existed, you have come into existence, and channelizing your mission is going to be critical. So I would say these are the two biggest challenges from strategic perspective that each NGO is going to face, in addition to various operational challenges, obviously, which are already there up in front of us. Thank you.
Sure. Thank you, Shripad. And I'm sorry, I'll take a minute's break because Shripad needs to move out of the conference because he has another call. So thank you so much, Shripad, for your inputs and being our panelist today.
Thank you, everyone. It was great meeting you, I would say. Yeah, appreciate it. Thank you. Have a good rest of the discussion. Thank you.
Thank you. So Supriya, you spoke of you or your organization working on a long term with same set of NGOs or having long-term partnerships. So in such partnerships and in such programs, how do you cope with delays? And by delays, what I mean is due to COVID-19, which has been the recent example. So there has been some delays and some roadblocks, definitely. So how are you coping up with that?
So again, two parts to my answer. The first one is, of course, as a process, what did we do? So, as soon as we knew that we were going into a lockdown, we initiated these multiple conversations with all our partners. We have a forum called Partners for the Goals. It's actually dedicated to goal number 17 of the Sustainable Development Goals. And for the last 5 years, it's a forum we use to connect to all our partners and also to facilitate knowledge exchange between partners and for them to take forward conversations, creations, and opportunities that they would want to pursue on their own. So this is something that we've been doing. So we use that forum to actually start these conversations to talk about, okay, what has hit us, and really connect at a human level, not as an organization that we are funding or they're funded by us, because let's not forget COVID-19 impacted us in ways that we had not imagined. And at the end of the day, we all need a bit of kindness and compassion. So it's, while we need hard numbers, I think right now the world, the community, the society needs a lot of kindness and compassion. I don't think we can get by beyond that, without that. So I think we tried not to artificially inject that into partnership, but we realized this is not the time to go for deliverables, because we are dealing with people, right? And people have families, and people are worried about their families, and communities are at risk. So our first focus was to make sure that our partners, our community members are safe. We, like what Pankaj said, also reach out to them to understand what were the immediate needs, and it was essentially around food. We also kept all the stakeholders informed. So if it was a board, or if it was any other stakeholder, to make sure there were no surprises. Everybody should know what kind of delays we are facing, what challenges we are facing. So that's the first part of my answer. The second part is, and this is easier to say now in retrospect, I don't really see them as delays, Tejashree, because in this delays that we have witnessed, we have seen innovations coming, right? So this period was used by our partners to look at different activities and different interventions. And I'll give you an example of a program that we launched, in fact, in March this year, and that got severely hit by the pandemic in Bihar. It's a livelihoods program, but also has education and healthcare as an element. And we are working with a very good partner in Bihar. And for the longest time, we said, okay, there are delays, we are not moving. And then during one of our conversations, we realized, okay, how about using this time to spread awareness on COVID-19 in the community? Because the community was badly hit by the pandemic. And Bihar really did not have an active campaign on awareness and sensitization on COVID-19. So that's a new activity that emerged from the delay. There was another activity, there was another intervention where in one of our vocational training programs in Pune, we used this time to digitalize the modules, the training sessions, so that the women could actually look at these modules on their smartphones or phones, and they could actually get on with some kind of training. So in retrospect, I feel this time period has been extremely creative, and it has really pushed us to think differently and pushed us to go into areas that we thought we would never venture into. And then we also do a lot of employee volunteering. So that's another aspect where we were like, oh my God, now our employees cannot even work in the community. And then we came up with this whole virtual mentoring, virtual volunteering kind of format. So I don't look at it as delays, and I would really, urge everyone to sort of reflect and look at these shining examples in their portfolio. And there will be several, I'm pretty sure of that, which will be like, these beacons of hope. And so I know it's a slightly roundabout answer to the question, but what seemed like delayed implementation is now turning out into prep for very, very innovative practices.
I completely agree with you. I think all you panelists have been saying this, that we have to look at, COVID-19 not only from a challenge perspective, but also how it was an opportunity. And for my audience, I'll just quickly summarize what Supriya you said, because there was really, really some important points. So definitely looking at innovation, then alternative methods of working with the same set of beneficiaries, augmenting your systems and processes, exploring new cause areas or geographies to work. Exploring what your employees are interested in terms of giving back to the community, and definitely leveraging technology, all have been those shining examples of how you can make best out of the worst. So thank you for that. I want to turn to Pankaj and kind of ask him to elaborate on I think Pankaj, you mentioned earlier that development does not happen in isolation, and I can't agree more. um, what I want to understand from you are how would you look at integrating some of the cross-cutting themes, be it gender or technology, into your existing programs? Because today is not anymore an age when we can ignore this and still go for the same envisaged impact.
Right. So I think I want to give a slightly contrary answer to kind of gender and technology and those kind of obvious things that we always feel are necessary and required. I think Supriya kind of really hit the nail. We need kindness, right? And I think we need to go down to that level. So we need collaborations. I mean, one thing which we realize kind of very explicitly is that a place like here, you have Tatas there, you have Forbes Marshall there, you have us there, you have Mercedes there, and we don't talk to each other. None of our CSR heads even know. I mean, if we bump into each other in the, I mean, we'll kind of talk about why you're coming so close to me because it's COVID and supposed to maintain 6-foot distance. We won't even know who they are. And our NGO partners also work in those little silos where there's a project funded by me, but that is being insulated from a project funded by the Tata Coms and being funded by Mercedes. So one thing which we have been really aggressive about in Pune is collaborations. Those organizing as opposed to organization point that Vasanthi made, I think that's a really, really, really critical point, that we need to get away from our banners and our logos and our kind of brands, because when somebody is dying, they don't care about whose logo is stuck on the ventilator or HFNOs. I mean, we need to have oxygen, we need to have the nurses, we need to have practitioners, we need to get the ambulance to get the person there. Everybody plays a part, and we are not doing it to get thanks from anybody or them to buy a little product. I mean, I think now there's a time to kind of go beyond that. So collaboration is something that was a really critical feature of how Pune as a city, as a community, corporates, industries, individuals, even civil society organizations that are quasi-religious in nature, everybody kind of stepped up without kind of really getting into who they are and what their mandate and what they're getting a salary for is. I think the second bit, I think, which is again equally critical, and again kind of going back to the Bajaj legacy, we need a Gandhi. We need to start talking about resilient communities. We need to start talking about, I mean, a lot of CSR, a lot of NGO conversation still is about dependence. It still is about we will do this. I mean, it has to be inverted completely or around itself, that communities are going to do X, Y, and Z, and where can we slot in our little support that we have? I mean, our support, our numbers are trivial in comparison to the larger development needs of India. But it's not that we are irrelevant. We start becoming irrelevant if we start taking on this entire burden that we are going to reform India. I mean, but there are places where our support will be critical. It will be absolutely essential. It will be life-saving if it happens correctly on the right day at the right time. And I think we need to start exploring these spaces. But I think we need Gandhi. We need that idea that communities are going to be the future of pandemic response or crisis response, not individual organizations. And how do we create strong communities rather than a better CSR program, a better NGO program? I think those to me are the two most important things. I mean, if there are cross-cutting themes, it is about resilient communities and it is about collaborations.
Absolutely. No, I can't agree more with you, because definitely gender technology, we discussed that, but the whole angle of making our approach more collaborative, not only the corporate NGO kind of a collaboration, but also corporate collaboration, and making the approach entirely more humane. I think these are the key takeaways from what you, Pankaj, said. Vasanthi, the next question and the last in the discussion is for you. Um, you heard the entire conversation, and you have been witnessing a lot of programs, interventions, efforts taken by not only the government but also by the civil society, corporates, etc. Tell me, how do you imagine the entire social development sector after 2020? Will there be any significant changes? Will there be any opportunities arising from these challenges? I think Supriya and Pankaj anyway spoke about it, but I want you to speak more from the social development sector perspective.
So I think personally for me, and as I look at across all the sectors, I think the pandemic has leveled us, particularly the key decision makers. Yeah. And I think the point that Supriya made, I want to kind of tie in because there were these little nuggets. And she said, it's really about the leadership at the top. And for the first time, the nature of conversations, when you have your direct reportee's mother in the hospital and all your company resources cannot help her, it has really hit hard at that level of decision making. So I think there is a certain sense of transformation that I see, and India doesn't need everybody to be transformed. You just need 1/3 of the country to transform for the remaining 2/3 to be impacted. Okay. And that I think is amazing that has happened at a very individual level. Second one, we always knew and we continue to be proud of is that it is ultimately that citizen middle class India through its 1 rupee contribution that keeps the social sector alive. Okay. And I think for some years, the NGOs forgot that. Now we are coming back and saying that it is that 1 rupee from 1 million people that will give me the corpus to be able to continue to exist. And that 1 rupee that somebody can give from their pocket is today relevant. And I think that's a shift that is important because at the end of the day, citizens have an accountability for their country. And as long as NGOs appreciate that the work that they are doing and the purpose that they are doing is a collective purpose, I think there is a constituency. Now that's a second one. We knew it, but it's always good to reaffirm. The third one, and believe you me, but I mean, it's such a delight on this panel to listen to the collaboration. The thing that I'm beginning to realize is there is an intent to collaborate. The question is, how do we build them into partnerships and alliances? Yeah. One of my biggest takeaway during the COVID is actually how can we harness the power of what we have at a management school in a way that we can create capability for different audiences across different sectors, and moving out of that an exclusive NGO leadership development program that we used to do. We are now transforming it into looking at a learning hub for professionals in development. Yeah. And not necessarily certifications, they may be byproducts, but in a larger canvas on how do we actually make this sense of community education that's accessible to anybody. And last but not the least, I think the most important one is that we have to recognize interdependencies. And I wish the vocabulary of the future is that inclusive growth, I mean, which has been mooted for 15 years. I think we now understand inclusion comes at some compromise with growth, and growth does come with some exclusion. I think COVID has shown both those dimensions. Yeah. So in some way, how can all of us across sectors look at this inclusive growth, not as your agenda and my agenda, but as our agenda? I think that place is where conversations, because there is a place for independence, there's a place for dependence, there is a place for independence, but above all, there's a place for interdependence. And I think if there's one thing that COVID has taught all of us is that interdependence is what we have to work together. Yeah.
Thank you. I think that was the best possible summary of whatever we spoke in the last hour or so. So I just want to recap the key learnings from the entire session before I conclude. So definitely we all agree pandemic has been a setback for all of us, but it has come with its own set of opportunities, and it is for us, be it consultants like us, be it corporates, academia, NGO like you, for unearthing these opportunities and how do we work together in a humane manner, and set our eyes on more inclusive growth. Its growth is not for a few people, it's for everyone, and become more interdependent. I think that was one of the key takeaways for us. So I really want to thank you all for sharing these insights and kind of taking time out of your busy schedules. I really hope our audience found these insights hopeful, meaningful, and insightful, and they will be able to incorporate that into their CSR interventions. Thank you once again for this time, and stay safe. Have a good day.
Thanks. Bye-bye.
Thank you.
Thank you.
Bye.
Thanks.